All right, well, I'm going to get started. I'll just lead a quick little prayer. Dear Heavenly Father, thank you for bringing us all together on this once again snowy morning. Help us as we learn to expand our knowledge each month. Be with me as I give this presentation so that I can speak clearly and everybody will understand. Amen. 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 So if you want to bring up the slides. Oh, yeah. So I'm Kurcz, and in my work, I'm retired now, but I'm a speech language pathologist. And in part of my training, at least in the past, you had to have a minor in audiology. And so today, this is really more of an audiological topic. And we had talked in our group, always trying to think of what are some topics that might be of interest. Tinnitus in and of itself affects almost 50 million US citizens. Ooh. And it, varying in ranges of severity. So next slide. It is tinnitus. A lot of people say tinnitus. And what you have to remember is that the suffix itis actually means infection. So we all know laryngitis, very common, itis at the end. Meningitis, there's a lot of things that have that on the end, and it's infection. But tinnitus is not an infection. And it's just a separate thing, and it's always pronounced, well, it's pronounced tinnitus. If you go online, you will find references to both pronunciations. I'm going from my training and working at University of Michigan Hospital. This is how it's pronounced in those settings. Next slide. So I'm going to stand for this. I don't know whether people online can see, I've got a pointer, but picture, this is the ear mechanism. The outer ear here, the middle ear here, and the inner ear over here. Oh boy, yeah, you can see.
I wonder if you can see my point. If you're online, can you see my arrow? Can you see the cursor?
Yes, yes, yes,
Great.
yes.
Try to copy what Karen's doing to help you.
Yeah.
Thank
So
you.
the ear is shaped. God did a wonderful thing. It is to collect sound, and that's why it's shaped that way. And the sound is directed through the canal. And of course, inside the canal, we have little tiny hairs and, earwax and all of that kind of thing. And then at the bottom of it is the tympanic membrane or the eardrum. The eardrum needs to be flexible. And as we age, sometimes that flexibility changes. If you have a problem with something blocking too much earwax is usually most common. Now in children, it could be a pee. Or something. Then there's less sound being directed toward that eardrum, and then the eardrum isn't going to move as much. And so that can cause some changes in hearing, which are cleared when the blockage is cleared. So on the eardrum, inside this middle ear, there are 3 tiny bones. The malleus, which is attached to the back of the eardrum. And the next one is the incus, and then the stapes. So there are 3 connected little teeny tiny bones. Each one moves the next one, moves the next one. So it's like dominoes. I like to think of it like Mousetrap, that game we used to play, where this led to that, led to that. So those 3 little bones need to move. And then on the inner ear side, there's a tiny thing called the oval window. And the oval window is where the stapes, or also stirrup, because it's actually shaped like a stirrup, attached to that, and that conducts the sound through that oval window. So we had the outer ear, and the middle ear, and now we have the inner ear. So the inner ear is really the one that's connected to brain. And in the inner ear, you have this big thing, the cochlea, you know, like shell, that sort of thing. We also call it the semicircular canals. And in this canal, lining it are millions of little tiny hairs or cilia. And there's a liquid in there. It's called endolymph. And on the little tiny hairs, we have little tiny crystals. They're calcium and something else. I can't remember what the composition is. You may have heard, you know, people with vertigo having to go and get vestibular therapy to realign the crystals, and that this is the area of the brain where that. From that, I can't go into the science of how exactly does all that get funneled, but ultimately it leads to the nerves that go to the brain. And those nerves go to kind of right behind where the ear is, kind of up and through the left temporal, frontal, parietal areas. And that is where sound goes to be interpreted. So that's kind of in a nutshell how it works. We can have, like I said, you can have a blockage in the outer ear, an infection. Some people get a bad infection in the outer ear, so that could be a blockage. Middle ear, you've probably heard with children, otitis media. Otitis, oto meaning ear, itis meaning infection, media meaning the middle of the ear. Otitis media, that's usually where fluid has built up inside that little space. And sometimes it's fluid that's fairly benign, but oftentimes it's fluid that's infected. And so then you're looking at antibiotics. Kids who end up with just constant middle ear infections end up having what they call tubes. And it's just a teeny tiny little tube that becomes a port through the tympanic membrane into the middle ear, so it drains the fluid out. And then you could have, I mean, you can have an infection in the brain that affects the inner ear. So that's kind of in a nutshell how it works.
Where does the earwax get created?
The earwax is created, so in the lining of the ear, the canal, tiny little,
Or the,
right in through here.
Right
So
in.
right in through here, tiny little pores where it's made. And it's made to collect stuff that's coming in. It's just that I know that having earwax buildup, it can be more of a problem as we get older. As our bodies are kind of drying out. And then some people, as they get older, they actually don't shower as often. And having a shower more often, whether you're not getting water in your ear, but you're in a humid environment. And that humidity is what helps to keep the wax more supple. And then you've all heard, don't stick that Q-tip down in your ear, because the last thing you want to have is accidentally hit that tympanic membrane with the Q-tip. Extremely painful, and puts a hole in it. Those heal, but it takes a little while and you just don't want to go there. So anyways, that's earwax.
I have a question. I had a kid in my Cub Scout den that had a cochlear implant. What does that do for the kid?
So in essence, you know, it's a little piece that gets mounted here and it's surgically attached in through the skull into
The
the
cochlea?
cochlea. Yes.
Okay.
And so it's essentially trying to do some of this work for that the auditory nerve is
So it's like
damaged and not able to do.
bypassing the nerve.
Yeah,
Okay.
yeah.
Okay.
I'm not an expert on that. It's
Yeah,
pretty
I just
complicated.
wondered, because he could not hear when he took something out. He could not hear.
Right.
He would hand it to me if we were camping out and say, I can't hear you now.
Oh.
Because it's really on the outside.
It is, yes, it is.
I didn't know that.
So we also have, if you've ever had a hearing test, part of the hearing test is they come in and they attach something, just a headband. And it's just sitting right about here
Yeah,
on
yeah,
the
yeah.
skull.
Yeah, I've saw
So
that.
we have what's called bone conduction. So we do get signals, just sound hitting our skulls. It's not adequate for hearing extended conversation, but it is a way of hearing. So anyways, they're checking when you have an audiological test, both the working of the ear itself, but also how to sound it through the skull.
Thank you.
Mhm. Anything else? We can always come back to this. Okay, next slide. So thinking of tinnitus, oh, I have it. Does anybody else have ringing in their ears, sound, weird things? Yeah, it's more common than we realize. It could be intermittent, it can be persistent. And they are phantomoses, they're not actually there. Your brain is, it's all in your head, it's. Your brain is, yeah. And it could be one side, it could be both sides, it could be one side one day and the other side the next day. Ringing is probably the most common that people will talk about, but clicking, buzzing, roaring. A hissing sound, those are what people describe the most common. And it can vary in intensity. I mean, it could just be really minimal background, or in some cases, sudden onset and extremely loud, and to the point where you just feel like you can't do anything. All right, next.
This is about a chair open, huh? Well, what do you do? Oh, that's it.
So what are the potential causes? Like I said earlier, it's not an infection. I mean. That doesn't come up in terms of causes. Which I was kind of surprised, because what if, there's something that we just don't know about? And we have an infection and, the side effect later was change, I suppose. Noise induced hearing loss. Loud environments. I've had a couple friends who commented on going to really loud concerts and having this happen afterwards. In both cases, it resolved. But that's kind of scary. Anyone working in a factory, anyone doing anything that has to do with machinery, woodworking, stone cutting, all that kind of thing, you name it. Gunshots. I have a friend whose son, they were out hunting, they were big hunters, and that day his son forgot his ear protection and said it's okay. And literally the first shot that he had, it's never gone away. And he's had it for like 15 years now. His was, debilitating. He had to move home, couldn't work. Now it's being managed, I think, and we'll get into that, but over time, I think it's dissipated and or the brain has kind of attenuated and gotten used to it, but that was scary. They called me within a week, what should we do? I'm like, I hope you've already been to the doctor. Help me. So anyways, anything that's loud. Aging, presbycusis. Okay, the prefix presby means age. So we have a lot of things that could have that part of the word. But anyways, it's a hearing loss just related to age. Earwax, we got into that earlier, or any kind of a blockage that is in the outer ear. I think that those are less common in terms of actually leading to tinnitus, and one would think if the blockage was cleared, that then whatever the symptom was would go away. Head and neck injuries, not unusual to have a change, a brain injury. I believe it could also happen as a result of stroke, which is part of vascular problems, a couple is on the list. Medications, when I was in school, antibiotics were looked at very carefully. Any antibiotic that ended in mycin, like gentamicin, vancomycin, those antibiotics can be hard on the hearing system. So they're careful, with that kind of.
Do those tend to resolve when the person stops taking that type of antibiotic or not necessarily?
Not necessarily.
Wow.
Like I said, vascular problems, I believe that to medications, so cancer treatments. It can
Oh.
happen with chemo. High dose aspirin. And that leads to, what does an aspirin do? It's a blood thinner, it's cardiovascular kinds of things. Non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, that sort of thing. Those can also have a blood thinning effect, and so I think that's sort of, and that, again, you take one, that's not an issue, it's probably for chronic use. As would be like chemo, if you're getting that for quite a while. So vascular issues could be high blood pressure. And high blood pressure and or stroke, tumors that could lead to problems, and what we used to call hardening of the arteries or atherosclerosis. Chronic issues could be autoimmune diseases, lupus, rheumatoid arthritis. There's so many rheumatoid or autoimmune diseases. Thyroid disease actually might be a precursor for that. Diabetes. Diabetes does many things. This is just one more thing. Meniere's disease. So Meniere's disease is in the hearing system. It's a combination of perhaps tinnitus with dizziness or vertigo. You might have an ear fullness feeling, something that's changed in your head, and just something's different. Meniere's disease, once you have it, really doesn't go away. But sometimes it's more mild and sometimes it's more severe. Temporal mandibular joint disorders. So things involving that joint here makes me wonder if it's more mechanical, for something about the joint, and then does that adversely affect what's going on in the inner ear, which then affects what's going on in the middle ear and then the inner ear. I'm not as familiar with that. Tooth grinding. Tooth grinding can be.
Did that hit home for somebody?
You're right, Glenn.
Yeah.
Right.
Good.
Right, yeah, where are you guys?
Yeah.
Then you won't run.
This is kind of like going to a psychology class. You're like, oh yeah, I have that.
Yeah, I have several of those.
Karen. My grandma, she had this pounding sound in her ears that lasted, I don't know, I feel like months, if not years, and she kept going to like an ear, nose, throat, or whatever, trying to think there was some kind of hearing issue. It turned out she had a very bad aneurysm just below her heart in the main aorta, and her heart was pounding like crazy, trying to get the blood past this,
Oh.
So, but they kept trying to treat her for a hearing disorder.
Wow.
Yeah. And she was, of the age where, what the doctor says must be right, and didn't seek alternative second opinions or anything, but it actually, she was in a hospital for some other kind of test. Oh, they had emergency surgery, she never would have survived, but anyway, it was a seemingly hearing problem that was really something else altogether.
So literally hearing a heartbeat sort of thing.
Yeah. She kept complaining, I just hear this pounding sound all the time.
Wow.
And that was the symptom she was having. That was all she knew. Yeah.
Again, well, and it kind of goes with that list of what are the sounds people hear.
Karen,
All right.
Mara,
Yes.
Mara has her hand up. Mara has her
Yeah.
hand up.
Oh,
I
I'm sorry, we
developed-
don't have, try to bring you up. Go
I
ahead.
developed tinnitus after having my first COVID shot. And fortunately, it eventually improved, but a friend of mine still has it. She got that after her first shot and has never gone away. So I wondered if that anyone else that had that sort of experience. I did eventually read that it was one of the possible effects of the vaccine. So there were other people around the world that got that problem.
Wow.
Wow, wow. Well, again, medication, yeah.
I can add
Say-
to that.
Go ahead.
COVID vaccination caused heart palpitations in me that took a couple weeks to go away. It also had my hearing coming and going. And I had 5 vaccines and then we decided it might not be a good idea. Because my niece lost her hearing, totally lost her hearing in one ear after one of her vaccinations, the COVID vaccine.
Wow.
My son was complaining that his hearing is not what it used to be. But I have tinnitus as well, and I had that before, and it's because I was working for hours in loud machinery, a growth chamber room full of growth chambers, and the compressors were going. So that's an ongoing thing that I'm hoping we can talk about if hearing aids actually help, because I just got hearing aids and it's made my ear ringing, which was under control, I guess by my brain, much worse.
Dear.
So I don't know if the hearing aids are causing more problems. I don't want to totally lose my hearing.
Right, right. So for you, Sarah, are you working with an audiologist and a ear, nose, and throat physician related to your hearing aids?
Yeah, I just worked with the audiologist with the hearing aids, and I had the hearing test. I saw the hearing doctor, but we didn't talk about possible causes for the tinnitus.
Yeah.
But I had a buzzing kind of tinnitus that drove me crazy because it only happened when I was putting my head on the pillow at night, and it was like an intermittent buzz, 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 buzz,
Uh,
buzz, buzz. And in physical therapy for my neck, I'd had a concussion, and I was replaying. I talked to the therapist about, why don't we do my concussion in reverse? So we replayed that in reverse, and my head was off its pin, and it cleared up right away. It was like I was born again.
Pat, you had something you wanted to say?
I was going to say, in regards to COVID, my son-in-law had COVID in early stages before the vaccine, and he got tinnitus from the COVID.
mhm, mhm. Yes, and I know just from COVID, hearing loss also has been reported. So not related to the vaccine itself, but it's hard to say. It's complicated, obviously. All right, we can get a picture.
Oh, of course, I found, you're waiting for me to change.
It's okay. Anyway, Sarah, with your tinnitus and the hearing aids, when you have a follow-up or make a follow-up with the ear, nose, and throat physician, or they're also called otolaryngologists, that'll be a good conversation to have. I mean, we don't have all the answers, but they at least need to know exactly what's going on. So next slide.
Thank you.
So your evaluation, you contact your doctor ASAP. If you've never had tinnitus before and you have it, call your doctor. And they may want to see you and or may make a referral to a specialist. I mean, sometimes, like I said earlier, if you have a history of blood pressure issues, that sort of thing, maybe they're going to want to see you to do an overall workup and see if there's something going on that can be managed immediately. Being referred to an otolaryngologist, also known as an ear, nose, and throat physician, and audiologist. This is my soapbox because of my training. There are many people out here or out there who do hearing tests. They're not necessarily trained as an audiologist. They might be a hearing specialist. So, an audiologist has an actual doctorate in the science of hearing. And they tend to work closely with the ENT groups. So at Michigan and Trinity Health here, we have some good resources for getting that combination. And if you have sudden onset, like I had, I knew immediately you needed to call. I just let my PCP know and she sent a referral and I called into Odo. And they set you up an audiological exam. They like to do a same day and then you see the physician or I actually saw a physician assistant who, this is one of his areas of expertise. So timing is important. The literature would suggest if you have a sudden onset, or maybe you've had it, but a sudden onset of much worse, you've got about a 2-week window to be seen and make decisions about whether there is something that they can do. What they found is that when people wait for, long, then in those cases, a lot of times it becomes a chronic issue and then it's a matter of how do we manage something that's more chronic. Your testing may include the audiogram, which has the various forms of hearing testing, whether it's the actual hearing or bone conduction, that sort of thing. Tympanometry is where they put this little thing in your ear and they're pushing in air for pressure just to look at how does your eardrum rebound. You may end up with an MRI. There might be blood work they want to do. MRI of the brain, obviously. In the MRI, what they're really looking for is, has there been a vascular, is there something that's obvious that's vascular? I know in my case, I've had more than one MRI, so now they can compare vascular from pre to now. But there's also a tumor that could grow on that nerve. That nerve is the 8th nerve. We have a series of 12 nerves that are in the brain that go into the body. The 8th nerve is the hearing nerve, and a schwannoma is, I believe it's typically a benign tumor, but it's growing in the wrong place on the 8th nerve, and then that can cause hearing issues and other issues, swallowing and speech and all kinds of things if it gets too big. So that's what they're looking for with the MRI. Blood work, again, that would be probably more like primary care, getting that to just look at what's going on. Diabetes, like I said, is something that can contribute to this. It's the blood work is part of that workup. Okay, next one. Next slide, there we go. All right, so looking at treatment. I think in the very beginning, I didn't have these in the right order, but they're gonna maybe look at medication, if it's acute, sudden onset, is there something you need to do from a medication perspective? In that disease called Meniere's disease, they believe that is related to buildup of fluid, that endolymph in the semicircular canals. You get too much in there, causing problems. And so that then we're looking at, do you need a diuretic to get rid of excess fluid, or do you need to look at, or do you need to look at a low sodium diet, try and reduce fluid retention, those sorts of things. So steroids, diuretics. In my case, they put me on a high dose steroid. Usually steroids, I don't know if anybody's had them before, usually they will taper you up. And then you go to the dosage that's required for a certain period of time, maybe a week, and then you start tapering. So in my case, he said that, this literature showed that a high dose, you go straight to the full dose. And then you stay on it for 7 days and then you just come off cold turkey.
Really?
It was
That's
a nightmare.
unusual.
It was a nightmare. I would never want to do that again. Not to prejudice anybody, but I'll tell you, I was a little, they talk about steroid psychosis. And it's real. I was kind of bipolar. I was a little manic. I was depressed. It was a little manic. I couldn't sleep, so insomnia was part of it. I had heart palpitations, and probably the mania was the hardest thing to deal with. And then I came off, and then 2 days later, I was already much better, you know, in terms of just the whole fact. My husband's like, oh, thank God you're back.
Didn't have the problem.
It went away.
Oh,
It went away.
so
It
the
was,
suffering was worth the.
it was worth it. It was worth it. It went away. So I was so grateful. And I knew every day I just woke up 6 more days, 5 more days. You know, that kind of mentality to get you through it. And it did go away. But then 2 years later, it came back. And the same kind of thing, sudden onset, although in that case, by the time I got the hearing test and then saw the doctor, it had already improved dramatically. And so that was when he was thinking, well, maybe you have Meniere's disease, because that can be waxing and waning on and off. And then I had vertigo with the second time, so he's like, well, it's maybe what it is. So low sodium diet. And a couple other things, no caffeine or alcohol. Yeah, I know. I haven't been able to do no caffeine, but, you know, less caffeine. Okay, so hearing aids. Yes, they say hearing aids, and I really, Sarah, I can't speak to, you know, exactly what it is about the hearing aid that would help with the tinnitus. For me, it makes me think, are we trying to, in the hearing aid, is there some kind of a masking? So, you know, if the sound in your head is a certain frequency and they match that with something that's similar, does that actually block it? So you're not hearing it at all or as much? We've all heard about noise machines, you know, white noise. You can get an app. I have an actual machine that's old. So nowadays, the app has so much more choices. I mean, some people, you know, they use it, they have it on all night. They can hear waves in the background or thunder or rain. That to me wakes me up.
Yeah, I don't like that.
I need just a consistent, but they also have white noise, brown noise, pink noise, purple noise. And it really, it's interesting to go through and just listen to the differences. Some of them are like, oh, goodness, who would listen to that? And then others are like, that's it. Perfect.
Yeah.
So there's something to be said for those. For some people, was it Pat? Something about laying down at night, or was it Sarah? Where you start to notice you're laying down. Sarah.
I only had it laid down.
Yeah, so. Like I said, you could have this on one side or both sides. So something about laying down, your ears on the pillow, it's blocking. And you hear it more, because now you've blocked surrounding ambient sound, and it's just the sound in your head. Maybe. It can come and go during the day. And so is it something about where you are during the day that there's noise around you and it kind of blocks? But you also get involved. I think part of it is the brain getting used to it. And you get involved in something and you're concentrating on something, and that's not even something you're thinking about. You know, you get diverted. I think in the beginning, it's really hard to trick yourself to not think about it if it's there, it's kind of loud all the time. Retraining therapy, sometimes seeing a physical therapist. I've heard about going to support groups, learning about meditation. Meditation, actually, when you think about what you're doing to your body, you're trying to change your heart rate, you know, change stress levels, that kind of thing. I think there's a lot to be said for looking at relaxation, meditation, counseling, and support. So anyways, I think the physical therapy is, I always thought of it more in terms of when you have the vestibular vertigo issues happening. But I'm not sure. Let's see.
There's a physical therapist that runs the dizzy clinic as far as treating dizziness.
Yes, yeah, there's a vestibular clinic at University of Michigan, and I think it's in other places too. That's actually all I had. I don't know if anybody has any questions. I know I didn't have a whole lot to.
So sometime, I mean, just occasionally, I'll maybe wake up, hear like a high pitched whine is what I think of, or just some weird, but it lasts maybe half an hour, and goes away. And is that the kind of thing could eventually be chronic, or is it something else? Like, where does that even come from? Because I'm kind of like, first you're like, are they drilling, a street away from me? And then like, no, that's coming from my own head. Like, what's up with that?
That's the intermittent, and
Okay.
it can be very intermittent, like.
Yeah, I mean, months would go by, but it's.
Yeah.
It's a very occasional thing.
Well, and when you think about, they say 50 million people are affected, and this is the wide range. So some people,
Yeah.
in your case, it's so random. And then for other people, it's every day.
Right.
All day long.
Okay,
So.
so I
yeah,
could have raised my hand earlier, I guess.
I mean, it's a phantom noise.
Yeah.
So, and what starts it, it's something going on in the inner ear and or how something is being conducted to the brain where we recognize sound. So, I mean, when we think about hearing and how sound is conducted, and I mentioned all these nerves, and of course there's, besides the 12 cranial nerves that have to do with hearing and breathing and speaking, swallowing, and that kind of thing. The rest of the brain having to do with, what are the pathways that go to the speech center where we can interpret what we hear, the temporal lobe for the most part, but it's associated with the frontal lobe and the parietal lobe. And we know how stroke can affect that kind of thing. So literally with some strokes, there's a change in how that what is heard gets interpreted in certain part of the temporal lobe. So some people, if you've ever met someone who's had a stroke who does not understand what you are saying, it's not necessarily a hearing loss. It's that the brain is no longer able to interpret that signal because that part of the brain that understands the language has been. So that would be different. Anything else?
It's very interesting, Karen, just realizing it's just your brain interpretation of these sounds or whatever, but it's not really something, it's not necessarily something wrong with the ear, like the cilia or something or whatever, the crystals, but it's how the brain interprets it.
Right. Yeah, and so it can be a combination. And then, vertigo kind of goes along with this, but they don't have to co-occur. So you could have dizziness and tinnitus, or you might have one or the other. And then sometimes you might have a combination. It varies among people.
Just two areas comment, relative to medications. Antibiotics are known to be ototoxic, right?
Yes.
Ear toxicity. And so years ago, the FDA said all antibiotics you need to test. And there are actually people who specialize in taking the cochlea, animals apart, and counting the hair cells.
Oh my gosh.
And so there are drugs that kill those little hair cells, the cilia, inside your cochlea. And the problem is there are probably lots of other drugs, including non-steroidal anti-inflammatories that may affect the hair cells, but we don't know. because nobody looks at them. It's so difficult to evaluate the hair cells that you only do it when you have a strong suspicion that drug might damage them. So it can be direct damage to the hair cells or a brain.
Right, yeah, so it might be just in the inner ear, but then the inner ear is no longer able to conduct that sound to the eye. Yeah, you're right. Yeah, it's fascinating, and it's complicated.
It is complicated.
And the cilia, do I remember like my high school or middle school biology that they get more rigid as we age so that they're not conducting as well? Is that correct?
Well, so you've got these little hairs with the otolith, the little crystals attached to them. And the crystals can change with age. And then the other thing is every one of those little cells is attached to receptors that go to that nerve that Karen showed us.
Yeah.
So you've got thousands of these hair cells sending signals to the auditory nerve. And I think mainly the crystals change as we age. More so than the cilia stop working. But if those cells die, then you lose some of that signal going to the brain. So you want to have lots of intact hair cells that don't go there.
Right.
And that plays a big role in our balance too, correct? So
Yes.
as if they function less well as we age, then that's another issue for us. Which is not the subject of your talk.
Yeah. Well, and then balance is how we're also connected to the cerebellum, this part at the back of the brain, which also is part of, connected to the vestibular system. So, damaged cerebellum can then lead to some of these problems as well. Your comment made me think of something and now I lost my train of thought. Hold on.
But yeah, it's not simple. It's not just regular hair cells. It's usually a combination.
Right.
things.
Oh, I know. I was gonna say, so as we age, it's not unusual to have sensory neural hearing loss. So it relates to that inner ear.
Yeah.
And it's oftentimes more of the higher frequencies. It's like the very high and some of the very low and certain sounds that we say, like the S and F, are sounds that are in a high frequency range. And so when you are listening to someone and you wonder, or you think they said one thing and they actually said another thing. I mean, it's oftentimes these various sounds that we have that tend to be in the high frequency range.
Yes, I was at my parents' house and their coffee maker goes beep, beep, when it's done. My dad cannot hear that. I was like, oh, the coffee's done. And I was sitting there. Wow, what? I'm like, well, did you hear it beep? Nope.
No, yeah, my dad's microwave goes off when he reheats it.
Yeah.
Oh my God, it's beeping for like to go out there. But, and then, that kind of thing happens so gradually over time, unless you have sudden exposure, that you just don't even realize what you're missing out on, which is, that's hard, hard.
Yeah.
Or for some people who end up with a cochlear implant, it can be a little bit hard to get used to the sound. Especially for people, as if they're getting them when they're older. I think that's what I've heard, or, that's the commentary I've heard from people. It was like overwhelming to then, not having heard and then hearing, sometimes in a very glorious sense. I can hear birds again, and then sometimes, whoa, this is way too much noise. I'm turning it off. Yeah, that's hard.
Wow.
Anything else?
How many people with hearing aids in the room or online have tinnitus? How many is that, Wendy?
It's 3.
It was 3 and
Maybe David.
did Debbie raise her hand? Debbie wears hearing aids. Did she
Yeah,
raise her hand for tinnitus?
But I don't know if she has tonight.
She did, she did.
I thought she did, yeah.
So there'd be.
There's one more, yeah.
Yeah, Dave.
It's the bane of people who grew up on phones.
Yeah.
You know, in the 50s and 60s. I hate to say that.
Oh,
Interesting.
farm equipment.
Yeah,
Noise.
yeah, because, well, we didn't have cabs on anything.
No.
So you were
Yeah.
exposed to all this noise all
Yeah.
the time. And like when I was a kid, we were still using dynamite to blow stumps out of the ground. We weren't sort of farmers. Nobody ever thought about wearing their earplugs.
Right.
You know, it was like, you know, why would you wear earplugs or have earplugs, you know? Now everybody wears.
Yeah.
When we were kids, it just wasn't a thing.
Some people take earplugs as giveaways when they go to concerts, you know, just to share with people. They're like, hey.
Yes, yes, and it's amazing. In that venue, when you have them on, you're thinking, wow, this is really loud, but then you take them out and you're like, oh.
Yeah.
This helps a little bit.
Yeah.
And nowadays, there are more people wearing the actual earmuff,
Yeah.
full-blown
Yeah.
Bose speaker, headphone, whatever. Because it can help. I wear them on airplanes. It's
Oh.
amazing, to use the background noise,
Oh, yeah.
because it can be pretty loud on a plane.
I've never
Yeah.
noticed that it's been loud.
So Karen, what should we do to be aware of people that might have it? I'm trying to form the question, but it's like, how can we be more welcoming, more less irritating or whatever? Do you know what I'm trying to say? How can we be helpful and not aggravating?
I think it's tricky because so many people have it. I don't know that we would. If we're doing presentations, we want to be loud but not too loud, you know. So many of us have kind of gotten used to it. I guess I have a friend personally who loves concerts. And I've had to say to her in no uncertain terms, I cannot go to concerts with you. It's just not worth the risk of having a noise exposure that would exacerbate the problem. And she's not real happy about that, but it's just not worth, you know, so I've had to advocate for myself. So if people are advocating for themselves, I think the main thing is to say, what can I do? What in this situation would help you? Because I think it might be different for a lot of people. And then for some people, you have it and it's just not a huge bother.
Well, it's nice to know the more you talk about it, you are aware that not putting some people in certain positions, certain situations that whether you know if they have tinnitus or not, you know, these are triggers. And so just to be more cognizant of what, if you're inviting somebody over for a gathering, there's going to be loud music. Think about that, you know.
Right.
Just
Even things like around the house, the vacuum, you'd be amazed. You know, the vacuum is actually pretty loud. Have I ever worn hearing protection when I vacuum? No, but I probably should. You know? Never thought about it. You know, just the things we do. I mean, we're pretty good. We use chainsaws a lot and we put hearing protection on for that, but that's kind of more obvious nowadays.
Are the small earplugs good enough to help? Like the foam ones?
It depends on how you put them in, you know, you have to kind of roll it. I always put mine in and just kind of gently hold it until it expands.
Yeah.
So that it's
So-
in as far as it
So
can
if
be.
we provided those, might that be?
Well, it's hard to say. I mean, it's really hard to say. For some people, and I've thought about going, the next time I go in, you know, is there something out there that I could buy that's maybe better than the foam? I don't know.
Like, do construction workers have like a more effective one that's not this, but maybe is something that they just,
I think they wear the vest.
Yeah.
right? Most
But I feel like I see people with something almost on a cord so you don't lose them so easily.
yeah.
I've seen that, but I don't know if it's really any different than a home one.
I don't think it is.
Okay.
I think
I
they're
don't
the same.
Yeah.
I carry my earplugs with me in my purse. I just keep them around. And in fact, I had dental work done recently and I always put in my earplugs when I'm getting dental work done.
Oh,
Because that drives me, that high,
Yeah.
that
Yeah,
awful
drill.
sound, they use with their drills. And I feel like my dentist, I think he needs to wear ear protection and he doesn't. Cause I've had this conversation with him, that sound is painful.
Well, and it's right near you.
Yeah,
It's right here.
well, you're getting a vibration, the transference of it from that too.
Yeah. My
But
last
like-
MRI. Yeah, my last MRI, they gave me hearing plugs,
Oh,
which they hadn't before. Oh my gosh, has anybody had an MRI? Oh gosh, so I'll just warn you. They ask you, are you claustrophobic?
Always
I
wear,
mean, go ahead.
always wear hear protect. They've always given me hearing protection.
Yeah, me too. I've had many MRIs and they've always given me earplugs.
Yeah, I've had ear protection too with an MRI. So
My
they
first
can-
one was like 20%, and I didn't
But-
say anything.
I always try to keep Kleenex in my purse, and if I get into a bad situation, I'll just make a little earplug out of
True.
Kleenex.
Yeah, yeah.
And there's always
So-
this.
And there's always this.
Fingers words. Oh my gosh, so here we were learning how to collate the bulletins.
Yeah.
Oh, the folding.
And the folding machine, so
Oh,
a
yeah.
lot of us were doing this because I didn't have my earplugs in my purse that day.
Oh, see, now there's a thing where maybe we should have a set of earplugs in that room
True.
for people who's, volunteer to do that periodically, but don't remember. We'll make a note.
But it didn't bother me. I mean, it was in the same room and it didn't bother me at all.
But what is the decibel level? Is it causing you injury even though it may not feel uncomfortable to you, but it
Maybe
might
I should,
still
yeah.
be.
Yeah,
Yes.
just to protect yourself for the future.
Yeah, Sarah?
Yeah, I'm concerned that the hearing aids, there were such loud noises and it was like picking up background noises and I couldn't hear the voices very well. And I felt it was causing hearing loss increased because my tinnitus was just background noise before and wasn't bothersome. It was, about 7 high-pitched noises or high-pitched, was like electrical noises. But since I tried the hearing aids, which they're quite fairly new, but I've hardly worn them because each time I wear them and take them out, then the tinnitus is even worse. So I think there may be cases where hearing aids are not recommended, but I just don't want to lose my hearing totally, so.
Right.
Well, as you all,
Good thing to ask your physician. Go ahead.
Yeah.
as you all are discussing hearing issues along with tinnitus, please be aware and please volunteer if you cannot hear any of the speakers, either in person or online. We're looking at possibly having the microphone available to use in the room in case people are having difficulties. So let one of us know, to speak up and say something about the hearing. If you're able to hear everything okay, please. Thank you.
Mary, I hear you better, but I don't hear in the room. It's like there's a lot of lack of clarity in the voice. But if anybody on Zoom part, I can hear perfectly, you're very clear, but
This
Zooming
is
the hybrid.
Yes, I was just gonna say, this is a big room. it's a big room and we don't have, like dampening in here, you know, like, tapestries and things like that help absorb, reverberations of sound. So, yeah.
A lot of reverberation. I guess that would be it.
Well, now, there's an interesting point because Hawkins is carpeted and we moved down to this space because of the bigger TVs and it felt a little more convenient not to be as far away. But maybe Hawkins, do you recall, because this is the first year we've done the classes in this space, I wonder if Hawkins really is a better space for these classes for that very reason, because we've had a few people bring up that the sound here has not been great. And I don't remember hearing that complaint. I could be wrong, but when we were doing our classes at Hawkins, I don't remember people saying anything about it. Those of you who Zoom a lot, what, do you have a thought about that? Was it
Try-
better in the
What
past?
happens?
I don't know. In a way, it's better in the Greenwood,
Oh, okay.
but I think it depends on the microphone placement. And if there's more than one microphone open, that might interfere. You know, you're sending out several signals at one time. There may be a millisecond off, but it's enough to create a little bit of
Well,
echo.
the only sound, the only thing taking in sound in this room is the owl. And that's always the case. There's only one sound input, so.
Okay. And the owl centrally located?
Yes.
Yeah, in fact, we made a fairly tight circle around it, just to see if we can address this problem.
It was better today.
Okay, that's helpful. When the groups are bigger, it's harder.
Wendy, Nancy has something to say.
Oh, yeah, thanks.
I don't Zoom a lot, but the Greenwood space is very echoey.
Yeah,
It's echoey when I'm there. I mean, at meetings, sometimes there's just a lot of noise because it's echoey. I don't have a tapestry to hang up, but a curtain somewhere. But I don't prefer Hawkins over the Greenwood space, but it is echoey.
Thanks, Nancy.
I would suggest that if people have overgrown house plants that they want to get rid of, you could put them in the
Greenwood.
area. It might help absorb the sound and.
I will bring it up with trustees because we have no acoustic ceiling in here.
Right.
And we could think about putting acoustic panels around the walls, which would probably help a lot because, yeah, that hard floor in here, we have a hard ceiling. So it might be as simple as putting some panels on the walls. I'll bring it up at our next.
Hey,
It's nice for worship though.
Yeah.
It's nice that people, feel encouraged to sing and that it's a good reflective space for singing. I would hate to lose that.
I know this would, whether carpet or whether to have a hard floor surface was part of the consideration of designing this space. But it works better for some things and maybe less well for other. So yeah, that's an interesting thought about whether Hawkins might actually in the long run be a better space for this event.
Thanks,
Right.
Wendy and Al for looking into that.
All right, Wendy, would you close us in prayer?
I would be happy to. Thank you so much, gracious God, for these beautiful bodies that you've designed for us, and they're very intricate and have so many wonderful functions, and we are grateful for the sounds around us. And bless us as we try to navigate when those systems don't always work as well as they were designed. And we appreciate the skills of speakers like Karen who can help enlighten us and give us information to help us live in these beautiful creations that you made for us. And thank you for this day, for the people in this conversation, and bless us as we go forth to be a blessing in the world. Amen.
And thank you, Wendy and Karen and everybody that showed up. So,
Yeah, thank you
so
very much. It was a very good program. Very timely,
Yeah.
very timely
Yeah.
for.
Yeah.
Good.
Oh, this place is
Thank
good.
you, Karen.
You're welcome.
Well, yeah,